In this recording, we're going to look at audits in Smart Dentist, and this is a bit of a change. I had people doing paper audits, but I've decided that audits are here to stay and we should make them online, easier to collect. So we go to our record and report area and select audits. And we have set up some default audits that I have written that should satisfy the accreditation standards because they're all generic and adapted from reputable areas. So let's have a look at workplace staff evaluation. This is needed for 1.10.2, which says that you've checked out that your staff members are working within their scope of practice for accreditation. But anyone can complete this. So we go to this, and I could say that I am completing the audit, and the audit is of my husband. And I've done it today. So, is this practitioner working within their scope of practice? Absolutely. Are item numbers used by this practitioner limited to those within their scope of practice? Yes. Have the item numbers been reviewed in the past 12 months? They certainly have. Does the practice have the current dental board and provider numbers for this practitioner? Yes, I have them online on Smart Dentist. Has this practitioner undergone the required Dental Board of Australia compulsory education requirement for the past log period? Yes, he has. He's very conscientious. Does this practitioner have access to the policies and procedures of this practice? Of course. Does this practitioner have access to clinical guidelines? It certainly does. And does this practitioner have access to ongoing training? He does, and the overall result of the audit can either be met or not met, and we'll do it again next year. So you can set a date, so it's recommended spelt wrong, for 1 year time, and we'll go save, and this appears in our audit list. So we have two things in our audit list. One is an example of each of the types of audits, so you know when the next one is due, and another list is all the audits that have been undertaken, and you can select by date when they're due and when they're not due. So that's audits in Smart Dentist now. A lot easier, and when you need to have supply them from QIP, just click on it, and you've got a very printable audit. This bit here doesn't change. The only thing that can be edited in the audit is the next audit date, because it's a bit easier to make a mistake. But other than that, there is no auditing. There's no changing an audit once it's done. If you want to redo it, you have to go delete, and that can only be done by someone with admin login. So audits under record and report in Smart Dentist.